A viral TikTok with more than 1 million likes shares what's probably all of our reactions to news about the emergence of Flurona. This is the nickname for when someone has both the flu and COVID-19 at the same time. There are also tweets like this one, claiming the two viruses merged together. And Verify viewer Mary emailed us to ask, have COVID-19 and the flu merged into a new strain? So Mary, let's verify. Our sources are the Centers for Disease Control and Prevention, the World Health Organization, and Assistant Clinical Professor of Medicine at the University of Colorado, Dr. Payal Kohli. The TikTok references an article from a newspaper in Israel from earlier this month about the country's first person to contract both viruses at the same time. Since then, we've seen cases worldwide, including here in the U.S. The CDC says it's possible to contract two respiratory viruses like COVID-19 and the flu at the same time. The WHO calls this a co-infection and tells Verify it's not evidence of a new strain. Researchers are still studying how these two viruses at once can affect the body. So it's false that COVID-19 and the flu have merged into a new strain. And even though they're generating a lot of headlines this month, the WHO says public health officials actually documented co-infection cases as early as April 2020. Fortunately, Dr. Payal Kohli, an assistant clinical professor of medicine at the University of Colorado, says physicians aren't seeing many co-infection cases.
So co-infections are not very common unless you're very unlucky, because it's highly unlikely that you're simultaneously going to be exposed to both infections.
With your Verify, I'm Brandon Lewis. To receive daily fast facts to your phone, text Verify to 202-410-8808. And to sign up for our newsletter, visit verifythis.com/email.